Hello everyone, I'm here to discuss my behavior change project for this semester. The title of my project was Increasing Imitative Repertoire by Teaching to Imitate Pointing at People or Objects. The purpose of my study was to look at the method of imitation and prompting and explore its role in increasing a child with autism spectrum disorder's abilities to independently imitate his therapist's actions. The participant in my project was a 5-year-old boy who was formally diagnosed with autism spectrum disorder at the age of 2. He currently receives 37 and a half hours per week of applied behavior analysis therapy at an outpatient center. He's at the center every day from 8 to 4:30, Monday through Friday. His ABA sessions consist only of one-on-one with the therapist, one in the morning and one in the afternoon. He has access to a variety of rooms in the building, but he has a home base which he stays in for the majority of the day. One of his target behaviors right now is to sit at his workstation, so he is similar to a classroom setting. The current key focus of his overall program is to increase his communication through having him learn sign language and encourage vocalizations. His program is structured around increasing age-appropriate socialization skills, visual perception, and listener response. He often struggles with making transitions, peer interactions, including eye contact, and he is an elopement risk. So for my project, I defined it as imitating pointing at people or objects is defined as pointing at the same person or an object that was pointed at by the provider. So in this case, pointing was defined as extending a finger in a specific direction towards an identified object or person. An example of this would be if the provider were to point at a person, the client would imitate this action and point at that same person. Or if the provider were to point at a yellow crayon amongst 3 other colored crayons, the client would point at that yellow crayon as well. A non-example of this would be if I were to point at a picture on the wall and my client did not respond, or if he were to point at a different picture. In order to tally the number of occurrences in which Chris would correctly imitate his therapist, I used frequency measure of tallying. The total opportunities that Chris had to be successful in each session was recorded, and at the end of each session, the number of correct responses were recorded as such, 8 out of 10, or for another example, 2 out of 10. These were then converted into percentages. The final number at the end of each session provided therapists with the correct number of responses out of the total number of opportunities for each session that was conducted. I and his program manager held a formal meeting prior to gathering baseline data in order to discuss the proper data collection procedures. His program manager observed and recorded IOA data 10% of the sessions of each phase. This occurred during my 15-minute breaks throughout the day when it was her role to relieve me. IOA was calculated using trial by trial and was recorded the same way as the data, as a percentage out of 100. In order to obtain treatment fidelity, there was a checklist that was used during this procedure, and it resulted in 100% for all of the 3 sessions. For the procedure, I used a single subject ABA design. Baseline was taken for 5 sessions, followed by the treatment phase for 5 sessions, and then a return to baseline for 5 sessions. During the entire time, I and his program manager were the only 2 involved in this behavior change project. His maintenance data was taken 2 weeks after the conclusion of the assessment, and they were taken during the afternoon sessions. During the baseline phase, I conducted his ABA sessions as usual. I would do a preference assessment and establish instructional control before beginning treatment. I made sure there were no minimal to no environmental distractions, and the SD "do this" was delivered. When Chris made a correct response by pointing at the same object or person, he received immediate reinforcement of his A reinforcer along with verbal phrase. When he made an incorrect response, I implemented the most intrusive prompt on the hierarchy of prompts. For example, it started with a full physical prompt, which would be to pick Chris's hand up, extend his finger, and point it in the correct direction. If he did not respond to the SD at all, this would be considered an incorrect response, and the same steps were followed. The results of my project showed that during baseline, he correctly imitated his coach, pointing at specific people or objects an average of 1.8 times over the 5 total sessions. During the treatment phase, using full physical prompts, which were eventually faded to partial physical and eventually verbal, the average number of correct responses increased to 6. And with the removal of prompts, the average number of correct responses increased slightly to 7.4 over the total 5 sessions. Alright, well, thank you very much for listening.